Because it's being taped. Alright. Or not taped, it's live streaming, right? Yep. So this is the first time for me with the live streaming. But anyway, welcome, and today's program is Welcome to Medicare Made Easy. Can we dim the lights a little bit? We don't want to be in total darkness, but maybe it'll just be. Okay, well, as Katie had said, my name is Diana Ducey, and I've been doing programs here for a long time. And when I say a long time, probably somewhere around a dozen years or more. So, and I've been working in the Medicare arena since 1992. So, I have a lot of experience in that. And so, let's begin. So, I've given you all folders, and for those folks who are watching from home, they should have been sent these handouts that I'm giving everybody. If you haven't received them, you can contact the library if they have them sent to you. And you don't really need them for this presentation. I just like people to have something to take home and look at later and say, oh yes, that's what she said, or what was that number, that sort of thing. So we're going to talk about the basics of Medicare, very elementary information, but then we're going to build on that knowledge. And then a review of the 4 parts of Medicare, and we talk about the basics. Then we'll talk about Medicare options, because as consumers, we tend to like choices. So Medicare gives us choices on how we can receive our Medicare coverage. So we'll spend a little bit of time there. Then we'll talk about Medicare eligibility and enrollment, and how you get your Medicare card. The Social Security offices are open again. I don't know if they're open every single day, but I do know that they are now open again, so that's good. And then we'll talk about the benefits of original Medicare Parts A and B. And as you may already know, Medicare is really very good coverage. And you may know that from your own experience or from the experience of friends and relatives that are already on Medicare. And then we'll talk about Medicare supplement plans. And then we'll have a short little quiz. I think I have like 3 or 4 questions. And the reason I have that quiz is because I find, as I'm talking to people all the time, not at my presentations, but if they call me, that there's a lot of misunderstandings out there. So there's like 3 things that I just want to go over and make sure that everybody's on board with so that they know that. And then of course we'll take questions. But I will take questions from you as I'm going along. And I don't know what that was. So, but if you would just keep the questions to pertain to whatever topic we are discussing at that time, that would be great. All right. So, excuse me, is maybe someone like asking a question? Oh, okay. It didn't bother me. Alright, so the basics. What is Medicare, right? You would think that that's a very simple answer, and it is. But someone, one day, they didn't really know at all what Medicare was. I'm like, oh, it's simply health insurance. And it's provided to us by the federal government. And of course, there are parts. Medicare A, B, C, and D. So Medicare Part A, that helps with inpatient hospital stays, it helps with skilled nursing facility stays, home health care, and a few other items that we'll talk about later. But with Medicare Part A, we usually don't have a premium for it because all the years that we are working and paying into the Medicare system, that's how Medicare Part A is covered. So as long as we have 40 calendar quarters, which usually equals about 10 years of Medicare covered employment, then we get Medicare Part A premium free. And if for some reason someone is married and they don't have those Medicare covered employment quarters, but their spouse does, then they can qualify under their spouse's work record. So 99% of the people on Medicare Part A don't have to pay for it, but there is a small segment that never paid into the Medicare system and then they can purchase it. So Medicare Part B we do pay for. But what does Medicare Part B cover? Physician's care. So things like surgery, office visits, testing, lab work, outpatient care, and we'll go into that a little bit more later on, but for right now I just want you to get sort of the gist of how it works. Medicare Part A, we pay for my hospital stay if I go into the hospital, but if I'm having surgery in the hospital, Medicare Part B will pay for that surgery. Alright, so Medicare A is very important and Medicare Part B is just as important. It just covers different items. So Medicare Part B, for most people, they pay $170.10 per month this year. And the rates tend to change every year, so they usually make those announcements at the end of November. However, $170.10, that's what we refer to as the standard Part B premium. You see, Medicare Part B can cost a person more because it is based on their modified adjusted gross income. So, for instance, if I'm enrolling in Medicare Part B this year, what Medicare will do, well, they will go back and look at my IRS tax returns for the tax year 2020. Always 2 years in arrears. So based on my modified adjusted gross income in 2020, my 2022 Medicare Part B premium will be based on that. Now, if I have what Medicare considers an average income, and that would be for a single taxpayer if you made less than $91,000 as your modified adjusted gross income, or as a married couple filing jointly less than $182,000 in 2020, then you'll pay the standard premium of $170.10 this year. However, if it was more than that, then you will probably pay more too. Now, the chart for that, if you're interested in looking at it, is in the 2022 Medicare cost sheet that I made available to everybody, which is in your folders. And it shows if you're over that much, up to such and such, it's this much, and it can get quite expensive. So, usually what people will say, well, my goodness, I'm paying almost $500 a month for Medicare Part B. Do I always have to do this? No. Medicare will review this every single year, all the years that we have on Medicare. So, if someone has to start out paying a higher amount, it doesn't mean they're always going to have to pay that amount. They would go back to the standard premium if their incomes fell within that standard amount. And also for those people, because I can't see you, which is difficult for me, because I like to see you, because I can see if you're like questioning this, and then I can go on a little bit more. But I do want to mention for the folks at home and for you, that if someone has to pay more for Medicare Part B, and maybe you had a situation that was a qualifying life event, someone quit their job, your hours were reduced, someone passed away, then you can always appeal that amount. And so it's called an income-related monthly adjustment amount, better known as IRMA. Okay, it's sort of easier to remember IRMA, right? Good. Okay, so Medicare A and B. So Medicare A and B is what is considered original Medicare. And what does that mean? Well, back in the 1960s when Medicare was developed, you could use any Medicare-approved provider in the country, and you still can do that today. So Medicare A and B, you are free to use any Medicare-approved doctor, hospital, medical provider in the country. And that's what makes it, nice for a lot of people.
So that's like a PPO then?
Well, actually, I think we're all old enough in the room to remember before they were PPOs, right? You always remember before they were PPOs. I do, okay? I remember in the late 70s, early 80s, it was just considered traditional health insurance. And that's more what this is like. The PPOs came around a little bit later on, more toward like the later 80s.
Thanks, Lisa. See you again.
So, original Medicare, use any Medicare provider in the country. Now, as I said earlier, Medicare A and B provide really good coverage. However, they don't cover everything. They leave us with deductibles to cover, and a deductible is the amount of medical services in dollar amount that we are responsible for before Medicare begins to pay. A co-payment is a fixed dollar amount that we will be responsible for, and co-insurance is a benefit percentage. And typically, we're used to things like 80-20, that sort of thing. And we'll talk about that a little bit later. You can choose to be responsible for these deductibles, co-payments, and co-insurance if you like, or you can say, well, maybe I'll buy a Medicare supplement, also known as a Medigap, because everything has to have more than one name. And this Medicare supplement, also known as Medigap, is an insurance policy you can buy from many insurance companies in Illinois, and it can help with the deductibles, co-payments, and co-insurance that Medicare A and B need you to pay. So the plan supplements your original Medicare A and B, and of course that would have a separate monthly premium. Okay, so basics. So far we just talked a little bit about Medicare A and B and what a Medicare supplement can do, and we will talk more about that toward the end of the program. But right now we want to say, well, what about prescription drug coverage? Because that's really important. And Medicare A and B do not cover outpatient prescription drugs, and neither do Medicare supplements. So back in about 2005, Medicare Part D was developed, and it's been available since January of 2006. So Medicare developed the Medicare prescription drug plan, but then allows it to be sold through insurance companies so you have more choices. You know, I'm just going to give you these folders so that someone comes in. Could you give me? Thank you. Thank you very much. You're welcome. So, this year in Illinois, we have 23 choices as far as Medicare Part D plans go. And that is a good thing. I know it sounds overwhelming, right? Well, Medicare.gov, that's the official website for Medicare, has a wonderful software program for Medicare Part D plans. So everybody on Medicare always should go to Medicare.gov, create an account if they have a Medicare number, and if you're taking any prescriptions, you can input those prescriptions. Now this is your account, and you're going to have a password, a username, and that sort of thing, so no one else is going to be looking at it. But what it is once you have put in your prescriptions, and then you can say, well, you know, this is the pharmacy I like to go to, and you can name like 3 or 4 different pharmacies. Then, once that information is input into the system, they have a software program where they will search for the most cost-effective plan for you out of the 23. And they will list all 23 with the most cost-effective plan being first. And they'll take into account the price of the plan, if there's a deductible, if you're paying for the deductible, and what your co-payments are for those drugs. So it's a wonderful tool that I suggest that everybody, you can help you manually look at 23 different plans. You could, right? All right, so good. So please note that Medicare Part D plans can change and do every single year. So you might be signing up for a Medicare Part D plan because you're turning 65 this month. Maybe you signed up for a Medicare Part D plan for September. Well, by the end of September, you're going to get changes from that plan that will be effective in 2023. So always open up that information because you will have an opportunity between October 15th and December 7th of every year to change your prescription drug plan. And if you don't make a change by December 7th, you'll still be in the same plan for next year, which could be fine or not so fine, depending on the changes for that plan. So, so Medicare Part D plans can be reviewed. Anybody can do this. You might need some help in the beginning, put some information into the computer. You can come here to the library, use your computer, and create the account, right? And then you can check the account later on your phone. And anyway, review all 23 plans, say, oh, okay, well, this one looks like it's the most cost effective, but the next one isn't too much more, maybe like that insurance company better. I mean, it could be something like that. So then you can choose your plan, and you can review this every year and make plan changes. October 15th to December 7th, all plan changes will be effective January 1st. Now, there might be more than 23 plans for next year. I don't know. We won't know any of that information for next year until October 1st. So, some basic information, a little review. Original Medicare, what is it? Medicare Part A, hospital, Medicare Part B, medical. We can have that Medicare A and B as the foundation of our medical care, and if we want, we could add a Medicare supplement to it. And that Medicare supplement would help us cover the deductibles, co-pays, and co-insurance. And then we can also add a Medicare Part D drug coverage, and we would have very good coverage doing this way. However, as I said, Medicare gives us choices, right? So there's another part of Medicare, it's called Medicare Part C. And when you are first enrolled in Medicare, you will be enrolled in Medicare A and Medicare Part B. You can choose to stay with that original Medicare if you like, and maybe buy that supplement and drug plan, or, because there's a choice, you can join a Medicare Advantage plan, which is also known as Medicare Part C, and the Medicare Advantage plans come in the form of PPOs and HMO. And most of us know that with the PPO, we have a choice of going in or out of network. If we use doctors and hospitals in network, we have a lower co-payment and co-insurance than we do if we go outside of network. And an HMO, a health maintenance organization, that's typically a little bit more restrictive because we need to use the doctors and hospitals in the network, except of course for emergencies. You can always go outside of the network for emergencies. But with HMOs and PPOs, both of them, you always want to find out if your preferred physicians are in their networks, because that would be helpful if you're going to go this route. So a Medicare Advantage plan is also known as Medicare Part C. So I'm going to share with you a little bit more information about Medicare Advantage plans, and then we're going to get back to our original Medicare A and B and Medicare supplements. So remember, a Medicare Advantage plan, known as Part C, is an alternative way of receiving your Medicare coverage. If I enroll in a Medicare Advantage plan, it is offered through a private insurance company that has been approved by Medicare. So if I enroll in a Medicare Advantage plan, I'm basically saying I want to receive my Medicare coverage from this insurance company and not original Medicare. So these plans are sometimes called Part C, MA for Medicare Advantage, or MAPD, which is Medicare Advantage Prescription Drug Plan. So many of the Medicare Advantage plans will include the prescription drug coverage in that plan. Medicare Advantage plans, like I said, are available through Medicare-approved private insurance companies, and they must follow rules set by Medicare. If you join a Medicare Advantage plan, you'll receive your Medicare A and B services from that Medicare Advantage plan that you chose, not original Medicare. So of course you're going to be given an ID card, right? And that will be for that Medicare Advantage plan, and that's the ID card that you would use for your medical and hospital services, and oftentimes prescription drug plan services too. When you enroll in a Medicare Advantage plan, you still need to pay your Medicare Part B premium, so you still need to do that. Now, people will say, well, they've looked at a Medicare Advantage plan and it only costs them $0 to enroll, okay? So they say, well, how do they do that? How do they give us all these services, for no premium? Well, if you enroll in a Medicare Advantage plan, Medicare says, oh, this person doesn't want to receive their services from Medicare, they're going to get it from this Medicare Advantage plan, so Medicare pays to take care of you and to provide you with these services. And with the Medicare Advantage plan, you will have co-payments and co-insurance amounts that are different from original Medicare. So, if you're enrolling in a Medicare Advantage plan, please do your homework and look at all the information they make available to you. Just don't look at that, maybe it only costs $0 to enroll, because you will have costs if you go to utilize the services. Medicare, like I said earlier, most plans include Medicare prescription drug coverage, which is known as Part D. Some other information. In most plans, in most Medicare Advantage plans, you'll need to use a doctor's, hospital, and other providers who participate in the plan's network, or you may pay more or all of the costs. And with some plans, you may need referrals. Also, in some cases, you may have to get a service approved ahead of time, which is called a prior authorization. And that would be before the plan would agree to cover it. So you may pay a monthly premium, maybe it's $0. We have to say $0, we can't say free. Or maybe you'll pay $30 or $80, something like that, for your Medicare Advantage plan, in addition to your Part B premium. There are co-payments and co-insurance amounts that are your responsibility for covered services, and they vary by plan. So pretty soon, at the end of this month, everybody on Medicare will receive a book, and it's called Medicare in View. It's a red, white, and blue, 8.5 by 11, and maybe the library will even be having some as like a reference tool. So, but you all get those, and if someone really wants one, I think the Social Security office on Roberts Road, they should have a supply by the end of the month, so you can go and pick one up there as well. But in this book, at the back of it, if it's an Illinois book, which it will be, right, most of the information is pertaining to everybody across the country, but in the back of the book, by state, for us in Illinois, they'll list all of the Medicare prescription drug plans and all of the Medicare Advantage plans that are available to you. So, but please look at a little bit more information than that. So they'll give you the insurance company's website and they'll give phone numbers that you can call. So really, please do your homework if you're going for a Medicare Advantage plan. And let me explain something and then I'll answer your question. Last year, they have all these commercials. Did you see them? About signing up with Jimmy, J.J. Walker, the guy from William Shatner, and then Johnny. Okay, those are the three guys. Okay. So, and I guess they were saying things like, don't miss out on the benefits or that you belong to or something. At any rate, I was getting tons of calls from my clients and they're like, Diane, what are these commercials about? So I'm like, okay, I'm going to watch a commercial. Because they thought it was coming from Medicare. But it wasn't, and they just want you to call. So because of that, and because a lot of people last year, or I should say, last fall, signed up for plans that they really were not 100% on board with what they were doing. Okay? There were a lot of complaints, enough complaints to Medicare by people that said, hey, I didn't know this, that now, starting October 1st, you call an insurance broker like myself or insurance, all calls will be recorded, and all those calls will be saved for 10 years. Because there has to be a way. And actually, I don't mind it, okay? I don't mind it. It was a little scary at first. I'm like, how am I going to do this, right? But I don't mind it. I mean, I've never had anybody complain about me because whenever I sold a Medicare Advantage plan, I think that people get annoyed with me because I go through line by line. Because I don't want them to come back and say I don't know, right? So, at any rate, so I'm just saying this so that you want to make sure that you do your due diligence when you're choosing a Medicare Advantage plan. With original Medicare, you're going to know enough when you leave here today, and Medicare supplements that you can make a decision about those if you want. But the Medicare Advantage plans, I bet you there's about 50 of them. You had a question?
I did. My understanding is that if you do participate in the Medicare Advantage plan, you do have the option to go back to original Medicare.
You have the
during an open enrollment period or something.
Yes. So every year during that open enrollment period, from October 15th to December 7th, you can, if you're in a Medicare Advantage plan and you want to go back to original Medicare, you certainly can do so. And conversely,
Well, one of the reasons that I was bringing it up,
okay.
do you have to have like a physical or something?
No, but wait, let me finish, okay?
Okay.
You can go back to original Medicare. That's not an issue at all.
Okay.
And just one moment, please,
Okay.
okay? And then if I'm in original Medicare, I want to go to a Medicare Advantage plan, I can do it that time too, from October 15th to December 7th, and it becomes effective January 1st. And I also want to mention that if you're in a Medicare Advantage for the first time, and during that first 12-month period, you say, hey, this is not my cup of tea, I want to go back to original Medicare and a supplement, you can absolutely do it. It's called a trial right. And then if you've been on a Medicare and Medicare supplement for 20 years, which I've had people do that, and they say, Diane, I want to try the Medicare Advantage plan, that's also a trial right, because they never tried it before. And during that first 12 months, they're given the opportunity that if they don't like it so much, they can go back to Medicare and a Medicare supplement. No questions asked. However, if it's more than 12 months, okay, then they can always go back to Medicare. That's not a question. But if they want to get a Medicare supplement, then the Medicare supplement can definitely ask them questions to see if they qualify for that plan. So that's what
And what are, like, is it based on
every
what
insurance
drugs you take?
Every insurance company would have different questions. So some questions might be, have you been hospitalized more than 2 times in the past 12 months? Have you been, and these are just, what I've seen. They could be all over the board. Which height, weight, I can't think, maybe medications, but
Would I understand that they might ask you if you have pre-existing conditions?
right. But it wouldn't be just a pre-existing condition. You're probably looking for certain conditions.
Say again.
They're probably looking for certain conditions. It wouldn't be just like, do you have a pre-existing condition? Because that would be actually a little bit too vague.
Okay.
So they would be more specific. Like, do you have this? Or have you had this within this amount of time? So
Can they charge you more of a premium then?
well,
Or
an
just
insurance company can deny you. They can deny you. So some of them can charge more, but it's usually just deny or approve. So when I've had a situation where someone has a Medicare Advantage plan, and it's usually like someone like our age whose parent is on a Medicare Advantage plan, all right, and they need to come off for whatever reason. They need to come off because now they have some issues and maybe the Medicare Advantage plan is not working for them. So the first thing that we do, we try to get them into a Medicare supplement first, and then once we have that approval, then we worry about everything else. Okay? So But I'm glad that you brought that up, and I'm glad that that was a question, but that's how it works. We do have a trial right for 1 year. And if it works for you, great. If it doesn't work for you, go back to Medicare and supplement. But to always get back to a Medicare supplement, they may ask you medical questions because you won't have to qualify for it. Okay. So let's see. Plans, Medicare Advantage plans can offer extra benefits like routine vision and hearing aid coverage and dental and gym memberships and all sorts of things like that. And each plan has a yearly limit, which is very important. It's called a maximum out-of-pocket limit. It's also known as MOOP. And it is always listed, like in the back of the Medicare book, what that maximum out-of-pocket is. Because the way a maximum out-of-pocket works is if you have a lot of covered services during the year, and it's through the network providers and so forth, all those co-payments and co-insurances start to add up. So if you reach that maximum out-of-pocket limit for that calendar year, that insurance company will say, you've reached your limit for the year, now you can have the services, at no cost to you for the remainder of that calendar year. Now those maximum out-of-pocket limits could be $3,000 or $7,000. So they're not exactly low.
But you don't have those out-of-pocket limits for Part A and Part B.
No, you don't have the Part A and B out-of-pocket limits. That's why when people have a Part A and B, they purchase a Medicare supplement. So that's how they limit their liability.
And then,
A Medicare supplement, I'll describe it later on. You don't have to worry about that so much. Okay, I'll describe that later. Remember, you must use your Medicare Advantage plan card to receive your Medicare covered services, and you have the option each year. Choose the Medicare Advantage plan, choose a different Medicare Advantage plan, or switch back to original Medicare. So, 4 parts. A, hospital, inpatient stays. B, physician care, surgery, outpatient care, Medicare Part C, Medicare Advantage plan, and Medicare Part D, prescription drug coverage. And then your Medicare coverage options, like I said, when you first enroll in Medicare, you'll be enrolled in original Medicare. You can choose to stay there, or you can say, I think I'm going to go with the Medicare Advantage plan. So that's your choices. Okay. And again, and this is just more information, and you can get copies of this PowerPoint if you wish. I mean, I send it in PDF format. Keep original Medicare or enroll in Medicare Advantage plan. With original Medicare, you have original Medicare A and B using any Medicare approved provider in the United States. With original Medicare, you can purchase a Medicare Part D plan, and you can also purchase a Medicare supplement to help with those co-payments, deductibles, and co-insurance. Or the Medicare Advantage plan, which is a Medicare approved plan from an insurance company, and it would have to be available to you in the county in which you live. Most Medicare Advantage plans include Medicare Part D. And note, if you enroll in the Medicare Advantage plan, you cannot also have a Medicare supplement at the same time. Because a Medicare supplement works with original Medicare, so you have to use the original. Okay. So, now on to the next section. Who is eligible for Medicare? Well, eligible people for Medicare include persons age 65 or older in the United States and eligible for benefits under Social Security or the Railroad Retirement Benefit System. However, even though we know that 65 seems to be the age for Medicare, most of us have known somebody under age 65 who's been on Medicare, and that's because they have been receiving Social Security disability benefits for at least 24 months, and in their 25th month of receiving those Social Security disability benefits, they're automatically enrolled in Medicare leave. And then for people who have received regular dialysis or received a kidney transplant due to end-stage renal disease, they become eligible for Medicare at an earlier age, the same with people who have ALS or Lou Gehrig's disease. Now, remember I said earlier today, Medicare Part A is premium-free for most people. Medicare Part B is not premium-free, and we really went all through this in the very beginning of the program. For those of you who came in late, that information is actually in your folder. And Medicare enrollment periods, initial, special, and general. And I will say that, these enrollment periods haven't really changed much over the years, but some of them are changing for next year, and that would just be basically, and I'll explain that in a moment, but this is for 2022. So the initial enrollment period for next year does not change at all, so that's good. So when I'm wanting to sign up for Medicare, when I'm turning 65, that would be my initial enrollment period. And the initial enrollment period is 3 months before I turn 65, the month in which I do, and up to 3 months after. So a 7-month window of opportunity. So I suggest that if you are turning 65 and you want Medicare A and B, that you start the process about 3 months before your birthday month. Okay, it's very easy to do. You can go online to SSA.gov, SocialSecurityAdministration.gov. They are the entity that handles the enrollment for Medicare. All right, or you could call up Social Security and you could ask for an appointment by phone if you want to do it by phone. And you could probably go into the office, but I don't know if they're doing simple enrollments in the Social Security office. You can always call them and ask them there. But you can do it on the phone or do it online. And you used to be able to do it in the office. So initially for those turning 65, there's your 7-month window. And if you miss it, you could pay a penalty. But you're not going to miss signing up for Medicare A and B. I'm sure that you're not. Because if you don't sign up for it during your initial enrollment period, and you wait to the general enrollment period, that's for people who missed their initial enrollment period and don't have a special enrollment period. And I'll explain what that is in a moment. But for general, then they have to sign up for between January and March 31st of the year. Their coverage does not begin until July, and they will pay a 10% penalty for each year that they could have been in Medicare Part B, but chose not to be. So we don't want to be in the general, right? We want to be either in the initial or the special. Now the special enrollment period is really for those people who have coverage due to active employment. It could be your employment or it could be your spouse's. But if you have employment, if you have coverage due to active employment, and say you're 65 and you're like, well, my goodness, this coverage at work is really good, it's very affordable, I'm going to continue working for the next 3 or 4 years, because a lot of people do, and if you want to stay in that group insurance plan, you can. The rules are, it has to be due to active employment, the employer has to have 20 or more employees, and of course you're getting the coverage through that employer. So you could do that if you choose. Some people say, well, I'm turning 65, I'm going to continue to work, but my coverage at work is horrible, or it's super expensive, so they can't wait to get onto Medicare A and B and make their options that way. So with the special enrollment, it's those who have employer union benefits due to active employment. And so then, if this person continues to work till they're 67 and they love their coverage at work, so they didn't sign up for Medicare A and B, when they're 67 and they say, you know what, I think I'm going to retire now, they would be eligible for a special enrollment period. And it would begin 8 months from the time their coverage ends. So they have an 8-month window which is like for Medicare Part B. But I always tell people, if you know you're going to leave like May 31st, start the enrollment process for Part B in the beginning of April, 2 months before you leave, right? So if you're going to work till May 31st, your coverage will end. You'll need your Part B coverage June 1st, so start the process 2 months early. And you can just request that you want the coverage to begin June 1st. And then those people who have special enrollment period, they won't get a penalty, okay? They're not going to get a penalty for that. So, enrolling in Medicare, initial enrollment period. The Medicare initial enrollment period, like I said, is a 7-month window of opportunity. My birthday is in October, so my initial enrollment period would begin when? July, August, September. I could still enroll in October, and then November, December, and January. But I would want my coverage to begin the first day of the month that I'm eligible, right? So I'm going to sign up before my birthday month. Easy to do. Took me 10 minutes online to do this. All right? Very easy. If you are born on the first day of the month, your coverage actually begins a month early. That's sort of good news for some people, right? So if you're paying a lot for your insurance coverage right now, and when you turn 65 on, say, like April 1st, and you're going to say, oh my gosh, I can get my Medicare coverage starting in March instead of April 1st. So that is good. And that would be automatic. This is just a picture of a Medicare card. If you haven't seen one before, it's very simple and clean. It's our name, it's our Medicare number, and our Part A and B start dates. So, if for people not yet receiving Social Security, which is a lot of people don't receive Social Security until after they're age 65, right? So if you're not yet receiving Social Security, you're going to need to sign up. You can do it online, you can do it online, by phone, or in person when that option is available. Okay, but most of the Social Security offices are open. You can go to SSA.gov, or you can call Social Security, or you can go through Medicare.gov. If you sign on to Medicare.gov, say you want to sign up for Medicare, it'll take you right back to the Social Security website. So, anyway, so the responsibility is on you. However, if you're already getting Social Security benefits or retirement benefits, your Medicare card is just going to appear in your mail one day, and it will be there about 3 months before your 65th birthday. So, if your birthday's in October, then your Medicare card will just show up about July in your mailbox, and that's only if you're already collecting Social Security. Is that pretty clear for everybody? Okay. Alright, so right now, this is the way it works. That I would want to sign up for my Medicare coverage to begin October 1st, and want to sign up during July, August, or September, right? It start October 1st, because right now, the way it works, if I wait until October to sign up, my coverage won't start until November. Oh, that keep it, right? And then if I wait until November, 1 month after I turn 65 to sign up, my coverage doesn't start until 2 months after. And then if I wait till 2 months or 3 months after I turn 65, then the coverage doesn't start for 3 months. So this is sort of changing in 2023. It's not going to be so, slap your hand sort of thing. So that's good. But I usually don't talk about 2023 things until 2023, right? Because you all might be turning 65 in the next month, 2 months, or 3 months. And if you are turning 65 in 2023, I'm sure you're going to sign up for Medicare before your birthday, right? Good. All right. So working past the age of 65, do I have anybody in the room that is in that situation?
I worked before I was 71.
Oh, okay. So anybody that is currently doing that, or maybe your spouse is still working, going to work past 65? Well, I'm going to go to this slide anyway, because I can't see what all those people at home are doing, right? So some people may choose to delay enrollment in Medicare Part B, because it costs at least $170 sometimes a month. They might want to delay enrollment in Part B because they or their spouse are still working. After the initial enrollment period has ended, they may be entitled to a special enrollment period. What are those qualifications? I'll repeat them again. If you or your spouse is still working for a company with 20 or more employees, and you are covered under the employer group insurance plan, you could continue that plan and that coverage at your job until you are ready to retire, and you don't have to sign up for Medicare A&B. And you would be entitled to that special enrollment period. Remember, I said it's an 8-month window, but if I were signing up, and I'm sure this is what you did, you sign up for Part B before you leave your job so that you have everything in place when you retire. Exactly. Did you have a question?
Yes, if you're still employed, you're covered under your spouse's coverage. Would you take A and not B?
Well, is your spouse working still?
Yeah, because the employer's plan would be primary, would be, right?
Well, actually, if you're going to be covered under your husband at his job, you could still take Medicare Part A, because the coverage at his job, if he's got 20 or more employees, would be primary. Yes. Okay.
That's how I was understood.
Yes, you are right. So, you can take, but unless there's an HSA involved, if the health savings account involved, then you shouldn't take A or B, as long as you keep that coverage at work. All right. So again, everybody should have Medicare A and B unless they have coverage to do after employment. And I stress that because I was at the Palos Park Library years ago, and I had someone in the audience, and he just couldn't get over that hump about actively working. Because I think he had been a teacher and he'd been retired for a while, so he had coverage. And he said, you're not actively working, right? You've got to be getting up, and then I couldn't even use the example of getting up and going to work the past couple of years, because no one was getting up and going to work. Everybody was getting up and hanging out at home and working there. So, But anyway, I think you're all pretty clear on that. If anybody has any questions, they can ask me. And then, as you probably know, if it were me and I was working for a company that large, 20 or more employees, and I work till I'm 67, then I need my Medicare A and B, then I just get some documents from Social Security. I fill out one document, my employer fills out the other, saying that Diane has coverage, do you active employment since the 1065. These two forms go to Social Security, they say, oh good, Diane had a special enrollment, she doesn't get a penalty. Awesome, right? Alright, so general enrollment period, if you didn't sign up for Medicare during your initial enrollment period and you don't have a special enrollment period available to you, you have to wait the first calendar quarter, and the coverage is delayed until July 1st, and then you pay that 10% premium penalty for every 12-month period that you missed out on it. It's 10% of the current monthly Part B premium, which is what, $170.10. The 10%, $17. If I skip out on 1 year, if I skip out on 2, it's 34, and then I'll pay that penalty the rest of my life. And every year it will adjust Medicare Part B premium. So, I have a guy out there somewhere, I met him probably 10 years ago, and he was told by some people at work, even though he was retired, that he didn't need Part B. And for 4 years he went without Part B, and then all of a sudden he needed something, right? So, like, and they found, oh, I'm supposed to have Part B. And he had a 4-year, that's all that time.
You pay it if you don't take Part D or prescription.
Right. So, and she just brought up, that for Medicare Part D, and, just to mention, if you don't take Part D, because I have a lot of people say, Diane, I don't take any prescriptions, I don't need Medicare Part D. Yeah, you kind of do. It's funny, they call it a voluntary plan, but if you don't take it, you'll be penalized. Now, if you don't take it because maybe you have VA coverage, Veteran Affairs coverage, or you have retiree coverage from a former employer, that's okay. But if you don't take it, you don't have anything else, then when you do decide to take it, because you will decide to take it one day, then you pay a penalty. The penalty is like 1% instead of 10, but it can add up.
Is that for the rest of your life?
You'd always pay for the rest of your life.
I don't see it, because I get that. Or you get payback penalty for the new.
So, original Medicare is primary payer. In most cases, original Medicare is your primary payer for healthcare services when you are 65 and no longer receiving health insurance coverage due after employment. Medicare Part A and B provide good basic healthcare coverage, but they weren't designed to cover everything. Those deductibles, co-payments, and co-insurance amounts on A and B, which I'll describe in just a few moments, are our responsibility. Original Medicare A and B, they do not cover outpatient prescription drug coverage. So our options when we have Medicare A and B is if we have group retiree health coverage, which most people do not have, but for those who do, that group retiree health coverage would help with some of the items that Medicare A and B need to pay, and group retiree coverage usually includes prescription drug coverage. But if you don't have that, you can buy a Medicare supplement, you can buy a Medicare Part B, or enroll in Medicare Advantage. Okay, Medicare Part A. So in the folder that I gave you in the second handout, it's 2022 Medicare costs, and those are just mentioned. You don't have to worry about writing anything down because all that information is right there. Medicare Part A help pay for hospital stays, semi-private rooms, meals, general nursing, and drugs. So any drug that is given to you while you are an inpatient in the hospital is actually covered in Medicare Part A. Skilled nursing facilities, skilled nursing rehabilitative care. Skilled nursing is exactly that. It's skilled nursing care, but it's designed to rehabilitate you following a hospital stay. Maybe that hospital stay, you were in the hospital for a week or so, and now you're weak and you need to rebuild your strength. Maybe you had surgery, maybe you had a replacement or a knee replacement or something, and you need to work that new knee. So skilled nursing is all about rehabilitative care. It is not custodial or long-term care. Custodial care is really to help with the activities of daily living, and that's not what skilled nursing care is about.
That's where home care services come in, private pay.
Actually, for the activities of daily living, home health care services provided in the home by a skilled medical professional, and home health care under Medicare would be for skilled medical care in a person's home. Like for instance, someone goes home following surgery and they need to have their wound looked at to see, now is it infected, is there a fever, what is this person's blood pressure, that sort of thing. But like just for the help of the activities of daily living, Medicare does not cover that. Medicaid may, but Medicare does not. If that's the way you
I'm distinguishing between home health and just home care,
Yeah,
which is private pay.
right. Private pay is home care. So yeah, home care is private pay. So home health care is medical care. Okay. Hospice care, that's treatment for someone who is terminally ill. Medicare helps with that as well, and any blood that you receive during the hospital or skilled nursing facility stay. So how are these things covered? We've got a deductible. So the Medicare Part A deductible is $1,556. That's easy, right? And if I go into the hospital and I have that deductible, if I have a supplement, most of the Medicare supplements will cover that deductible. But you know what's a little funny about the benefit period on Medicare Part A is the way it's designed. Although I will say it benefits everybody on Medicare. We are used to benefit periods that start usually on January 1st and then December 31st. There's usually a 12-month period of some sort of fall. A benefit period under Medicare, as I've written down here on the bottom, begins on the day you're admitted as an inpatient in a hospital. So that's the first day of my benefit period. And my benefit period ends when I haven't received any inpatient hospital or skilled nursing facility care for 60 days in a row. So if I'm admitted into the hospital on October 1st, and I'm released on October 5th, and I go for 60 consecutive days without going back into the hospital as an inpatient or skilled nursing facility as an inpatient, my benefit period will end on or about December 5th, 60 days after the date I was discharged. Okay? And if that should happen, and I go back into the hospital on December 15th, I'm going to start a new benefit. Okay? Yeah, I'm going to have a new deductible to me, but if I have a supplement, we're more than likely picking that up. But with every benefit period I have under Medicare Part A, I have 90 days of hospitalization coverage available to me. The first 60 days, I just have that deductible, and the rest is covered by Medicare. Perfect. For days 61 through 90, I would have a co-payment of $389 a day for each day between 61 and 90. Again, if you are purchasing a Medicare supplement, that co-payment is covered by all Medicare supplements as a basic benefit. Alright? So that 90-day benefit period can start, stop, replenish all throughout my life. If I ever need more than 90 days of hospitalization coverage, and I've exceeded those days of my benefit period, then Medicare gives me lifetime reserve days. They give me an additional 60 days of coverage. This can be used over my lifetime. My co-payment is $778 a day, so it's doubled. And again, if I use these days and I incur that co-payment, if I have a Medicare supplement, my Medicare supplement will pay it. Alright? Hopefully none of us ever need that days, right? Those 90 days are always replenishing, but if I need some lifetime reserve days, if I use 5 of the 60, then I only have 55 left in my life. And again, any of this information is always found in the Medicare and book. And like I mentioned to someone yesterday, you come to a meeting like this, you listen, you learn from other people too that are in the meeting, which is always good to attend them. And then you read about it in the Medicare and book, and it all starts to make sense. Right? But I always really want to stress to everybody, Medicare coverage is very good coverage. Skilled nursing facility. So if I'm in the hospital, say from October 1st to October 5th, and I've had maybe a knee replacement done, I might not know how to walk with that knee, right? So if I've been in the hospital at least 3 full days as an inpatient, and my doctor prescribes skilled nursing facility coverage, and I use an approved skilled nursing facility, I can go there, and the first 20 days is covered in full by Medicare. If I need to stay longer than 20 days because they feel like I need to, I'm improving, but I'm not quite there yet, for days 21 through 100, I would have a co-payment of $194.50 a day. Again, if I have a Medicare supplement, many of the Medicare supplements cover that co-payment for me. So
If you get a knee replacement, for example, Do you have a choice of going into a skilled facility, aka nursing home, or getting rehabilitation at home?
Well, I would think it would be between you and your doctor. Okay, so for people who didn't get a question, can you go to a skilled nursing facility or do you need to go to can you just have the care at home? I think it depends on the health of the patient, but I think that would be a good question for our physician.
Okay, so it's possible not to have to go to a nursing home for your rehab
Oh, right, but
if the
if your situation justifies it, right? I mean that would not be me making that decision, that would be the doctor.
it's not Medicare making that decision.
No, because oftentimes, you do go home, and oftentimes I shouldn't have even used knee replacement because it's usually outpatient now. For some people, but not all. Some people have an inpatient. It all depends on their situation. If it's outpatient, then my husband, when he had it, he came home, I was scared to death. I'm like, oh my gosh, now what am I going to do with him? Right? I was so worried that he was going to hurt himself. He walked up 13 stairs and went to bed. He was fine. And, he didn't walk fast. He didn't run. But at any rate, he did have his care all at home. And then we just went to an outpatient.
Right, okay. Thank you.
It just all depends. But the main thing is about skilled nursing facility. Again, this falls under Medicare Part A, and you do just have 100 days of skilled nursing facility coverage per benefit period. And again, if you're fine on day 40, they'll send you home, right? If you're not improving, or if you've improved as much as you want to, they can send you home after day 40. So, in another case, if someone said, well, I need to stay there after 100 days, and just a moment, please. After 100 days, then it becomes private pay. All right? But again, if I'm released from skilled nursing, let's just say on October 17th, and I go for 60 days without being readmitted into the hospital or a skilled nursing facility for 60 days, 60 days go by, December 17th rolls around, if I go in the hospital after that, my per day benefit period begins again, my hospital, my skilled nursing days are replenished. Any other question?
No, I was just going to say, just for the benefit of those here and for your parents, if they're still alive. My mom lived with me the last 7 years of her life. She had broken her leg. She had to go to a rehab place for 8 weeks. Well, she stayed 8 weeks. They wanted to kick my mother out after 10 days. And we went to Medicare to fight that because there was no way my mother should have been coming home. And then Medicare, they extended it for 8 weeks. I mean, which was a tremendously,
It was a huge help. Right.
She needed assistance. They clearly didn't. She was in her 90s at the time. They wanted to kick her out. Just, think even if your parents or whatever. Because we were like devastated. We're like, kicking my mother out for 10 days? So, remember, you have to fight. And Medicare.
You have to be an advocate. Everybody needs an advocate.
And Medicare was really amazing. I mean, within 24 hours, they basically told this place, you're not kicking this woman out. So, it was our own anecdotal experience.
Yes. No.
Did you need the help of her doctor for documentation or anything?
No, actually not. No. Just based on what had happened to my mother, they knew this was, obviously Medicare knew it was absurd.
She was first. You're referring to original Medicare and all of this. And
Yes.
So if you have an Advantage plan, can they do this differently or do
They
they have to?
absolutely do it differently. Okay. So that's why this program is about original Medicare A and B and Medicare supplements. But I do describe the Medicare Advantage plan only so that you know that they're a little bit different and to do your research on it.
I was just going to add, my mother was in a nursing home because she was in the hospital, and the physical therapy kicked her out after 2 months. But she came home and we got a little bit of in-home care, but I had to fight and get her on Medicaid to get her back into the nursing home. And but it was physical therapy throughout, saying that she wouldn't progress anymore.
Right. But, that does happen. Because you're there to rehabilitate, and if you're no longer rehabilitating, they can send you home. So just because it's 100 days does not mean here's 100 days. It means up to 100 days. All right. So, Medicare Part A costs, home health care services, medical services you receive in your home by a skilled medical professional, your costs are zero for the Medicare approved services. Hospice care, care for someone who is terminally ill, the costs are $0 for hospice care, but that person would have a copay of up to $5 for the drugs that they might need, okay, to keep their, could we just hold on to the questions, because thank you. And they would also be responsible for 5% for inpatient respite care. And then the blood, your costs are for the first 3 pints of blood per calendar year. So it's called a blood deductible, which sounds sort of crazy, except for the fact that the cost of blood varies all over the country, right? So you are responsible for the first 3 pints of blood. However, if you're an avid blood donor or someone whose blood and half, then you don't have to pay for it. If you have a Medicare supplement, it's covered by Medicare supplements by most of them as a basic benefit. Okay. So Medicare Part B. Medicare Part B is easy, and we talked about this being $107.10 per month, and we talked about it maybe more for some people based on their incomes. Medicare Part B, what does it cover? Physician services, outpatient care, lab tests, x-rays, home health services, durable medical equipment, other medically necessary services like ambulance and emergency room services, and supplies like blood testing strips for people who are diabetic, and physical, occupational speech therapy, and many, many, many preventive benefits. And by the way, that Medicare.gov website that I mentioned earlier, if you want a booklet, let's say you want a booklet on durable medical equipment, or skilled nursing facility care, or even like durable medical equipment, I gave that example already, or even like physical therapy, there is usually a booklet published by Medicare that goes through these things in very, detailed in format. So you could download it, you could ask them to mail it to you, I don't know if they'll still mail it to you, but you could download it, print it, whatever you like to do, but they have many, many booklets. Because to be quite honest with you, when somebody has to go to skilled nursing, most are like, what? Now it's like scary, and so you want to find a good skilled nursing facility. They do have a skilled nursing compare thing on the Medicare.gov website, but sometimes at a certain age, everybody starts to know where the good places are to go, I think. So, but if you want more information about anything Medicare, even the preventive services, they publish a booklet almost on every single topic. So, your original cost, original Medicare Part B cost. So, calendar year deductible this year is $233. That deductible usually changes every year. So they will announce that usually toward the end of November what the deductible will be for next year. So the calendar year deductible for Medicare Part B. So now we're back to like a regular deductible, regular calendar year benefit period, right? So that's good. And then after the deductible is satisfied, Medicare pays 80% of the Medicare approved services for you, and you are responsible for the remaining 20%. Now that 20% could be a lot or a little, depends on what you're having done. However, keep in mind that 20% can be paid by your Medicare supplement if you purchase a Medicare supplement. So, and then we have something called excess charges. So let me just give you an example of something. So let's say I go to the doctor and the bill is $100. And for just the ease of explanation, let's just pretend my deductible has already been met for the year. Okay? If it wasn't met, I'm going to have to pay for that $100 doctor visit, right? So I'm going to be responsible for the first $233 in medical services for the calendar year. And then I go to the doctor, he charges me $100, the bill goes to Medicare. Medicare is, because remember, they're the primary payer here. So Medicare says, oh, Diane went to the doctor, the bill's $100, but we're going to approve $80. If they approve $80, then they're going to pay 80% of the $80, okay? Because that's their policy. 80% of the Medicare approved amount. 80% of $80 is what? $64, right? Then I'm responsible for the remaining 20%. 20% of the Medicare approved amount would be $16, okay? If I have a Medicare supplement, my supplement. So, when I mentioned earlier that when you're on Medicare, you just have to use doctors that agree to accept original Medicare. Absolutely. Some of those doctors, or many of those doctors, I should say, also accept something called called assignment. If a doctor on Medicare accepts assignment, they will accept that Medicare approved amount as payment in full. So if I went to the doctor and he charged 100, but Medicare only approved 80, the doctor accepts Medicare assignment will say, Diane, as long as I get 80 consult, right? And 64 is coming from Medicare, 16 comes from me or my supplement, they're good to go. It doesn't matter. However, if I use a doctor who accepts Medicare only, they do have the right to charge you what is known as an excess charge. So that $100 visit, where Medicare only approved $80, the doctor can say, you know what, I don't accept assignment, so I can charge you an excess fee, which would be 15% of the Medicare approved amount. And my simple little explanation today, 15% of $80 is only $12, and most of us would gladly pay $12 to go to the doctor that we want to go to. However, what if that doctor wants to perform surgery? All right? Now, surgery can be a lot more expensive. If he only accepts Medicare and not assignment, and I'm responsible for excess charges, my excess charges could be very high. So that's a differentiation between doctors who accept Medicare and Medicare assignment. And if you are purchasing Medicare supplement, there is a Medicare supplement that covers excess charges, so you don't have to worry about it. All right, so let's just talk about some of this is just more about excess charges. So for preventive services, we all know what preventive is, right? We get a screening done, they're just checking to see if there's any hint of something going on that we don't have symptoms of yet, right? So Medicare has a lot of preventive services that they cover. For some of these preventive services, they don't even charge the deductible. They just say, no, the deductible does not apply. Great. And then if I go for a preventive service and the doctor accepts Medicare assignment for some of those preventive services, they will just accept whatever Medicare pays it. So that's nice too. Now, at one point in my life, I used to memorize which one waived the deductible, which service, and I'm like, well, I just didn't do that. It's sort of silly, right? So we have a great guide called Preventive Services that you can see right there. They waive the deductible, and if the doctor accepts Medicare assignment, well, they accept the total amount that just Medicare pays them. And who this really is good for is people who don't have anything else besides Medicare A and B. Then that would become very, very important to them. And Medicare did this because they want people to take advantage of those preventive services, because the sooner something is found, then usually the less expensive it will be to treat. So let's move on a little bit. Preventive services. Welcome to Medicare Preventive Visit. That's available to you the first 12 months that you're on Medicare Part B. All right, so, and again, not 12 months in a day, but just for the first 12 months. If you need that, and I suggest that everybody take advantage of it, when you call your doctor's office, tell them you're calling to schedule a welcome to Medicare visit. So they can tell you, we don't do that, okay? Or we do that, and then they know how to code accordingly so that your visit gets paid for. Diabetes screenings, Medicare Diabetes Prevention Program, if someone is at risk for diabetes, that's been covered, and that was given in, or it is given in classroom style, and that is a benefit that came about right around 10 COVID came out. So I don't know, how many hospitals do that prevention program, but it's a very good tool to have. Depression screenings, mammograms, prostate cancer screenings, colonoscopies, and other types of colon cancer screenings, bone mass measurement tests, obesity screenings, pneumonia, hepatitis B shots, flu shots, of course, are covered with COVID shots. Sometimes people start to think, oh, shingle shots. Shingle shots are not covered by Medicare Part B. They were done so initially in 2008 for like 2 or 3 months, and they quickly shipped that over to Medicare Part D, the drug plan. Because typically, if your shingle shot is covered by your Medicare Part D plan, you will have a deductible to meet. And because it's an expensive shot, and now they're, of course, giving it 2. Like a series of 2 shots. So Medicare Part B does not cover shingle shot. Tobacco use cessation counseling sessions and alcohol misuse screenings are also covered in Medicare Part B. So what are some things Medicare Part B does not cover? Dental, routine eye exams related to prescribing glasses, and you can buy dental insurance policy, you can buy vision. They're not like specially for seniors or people over 65 or whatever. They're just like regular dental regular vision plans, similar to what you've had while you've been working. Routine physical exams are not covered by Medicare. hearing aids and the exams for fitting them, cosmetic surgery, massage therapy, and concierge care, and health care outside the United States. So a lot of people like to travel and they want to go outside of the country. So I always do suggest buying a policy that covers you for emergencies while you're outside of the country. And those are not too terribly expensive at all. Usually depends on your age and how long you've been gone. So what are some of these items again that Medicare A and B was to pay? In summary, we've got that Part A deductible, which you could have happen more than once in a 12-month period, based on the way the benefit period is designed. We have the hospital co-payments of $389 a day for days 61 through 90, and $778 a day for days 91 to 150. We've got the skilled nursing facility co-payments for days 21 through 100, and that's $194.50 a day. We've got the hospice inpatient respiratory care co-insurance of 5%, and of course that's to be determined by how much that is. And I don't think I mentioned that earlier. So the hospice inpatient respiratory care co-insurance, if someone is receiving hospice care, and usually it's in their home, their caregiver's home, something like that, they have a caregiver, of course. And of course the caregiver is paid for by the patient, not Medicare, or maybe it's just a friend or a relative. But if that person cannot be there for a few days, and the patient cannot be left alone for those few days, they can go to an inpatient facility that offers hospice care. Medicare will pay 95% of the first 5 days. The patient pays the remaining 5%. And then the free-fund blood deductible that we spoke about, the Medicare Part B deductible, which changes every year. This year it's $230, and the 20% that Medicare Part B leads us to pay, and those excess charges. If I lose a physician, who only accepts Medicare and not assignment. So I can get a Medicare supplement plan that covers almost all of that. So Medicare supplement plans are also known as Medigap plans, and they're a great guide. And that's also published by Medicare, and it's called the 2022 Medigap Guide. And then right underneath it in front it says Medicare supplement, right? So that's a very good guide to get, and you can get that by just going online and printing it or having it sent to you. These are health insurance plans offered by private health insurance companies that help supplement original Medicare. There are 10 Medicare supplement plans. They are standardized throughout the industry. Medicare designed the plans and said to insurance companies, if you want to sell it, this is the plan that you can sell. We're going to give you a benefit design, and it cannot be deviated from this benefit design. It makes it very easy for us then to choose a plan. These Medicare supplement plans help cover the deductibles, co-payments, and co-insurance amount that original Medicare needs you to pay. To be eligible for a Medicare supplement, I'm going to need A and B, because remember, A and B is the foundation of my care. And what I really want to happen is for my A and B and Medicare supplement to all be effective on the same day. Very easy to do. Okay? You can start shopping for a Medicare supplement 6 months to a year before you need it. You can apply for it. If you know that you're going to be 65 on May 1st of 2023, you can start shopping for it now. And, have it effective, and then just get your Medicare A and B within 3 months of turning 65. So the open enrollment period for Medicare supplement, this is important. It's a guaranteed issue period. The first 6 months that you're on Medicare Part B and 65 or over, you have this guaranteed window of opportunity. You can apply for any Medicare supplement plan you want, period, in the state in which you live. Great. Okay, so if I'm turning 65 on October 1st, I've got 6 months. After that, too, right? Like I can make my decision now that I want it effective October 1st, but I can change my mind and go for another Medicare supplement. They don't have to ask me any questions. If I wait till 7 months later, then they have the right to ask me questions to see if I qualify for the Medicare supplement. Right? Now, if I have like retiree coverage or something like that from my former employer and that goes away, I would still have some other guaranteed rights to a Medicare supplement. But I just wanted to mention this one. So it offers you the right to purchase any Medicare supplement plan sold in your state of residence. As I said, there are 10 standardized plans, and they're identified by letters, which is crazy, right? Because we just talked about Medicare A, B, C, and D, and you think they could have given these numbers or colors or something like that, but they didn't. So you always want to remember that Medicare supplement G, K, L, M, and N are on top of Medicare A and B. Okay, A and B is the foundation of this building. Underneath this floor, right? There's a foundation, a basement, something. And there's my A and B. And then in order for me to have better coverage, I can buy a Medicare supplement that goes on top of it. They're just called by letters of the alphabet. Now, all of these policies offer the same basic benefits, and I'll go over what those basic benefits are, but some offer additional benefits so you can choose which one meets your individual needs. Some of you may be married, and if you have had coverage through one of your employers all this time, you've always had the same coverage as your spouse or your kids or something. So now when you're on Medicare, you make an individual choice. Whatever choice you make, that affects you. Your spouse can make a different choice. Okay, so down at the bottom, since January 1st of 2020, Medicare supplement plans sold to people who are new to Medicare as of 1/1/20, okay, because they could have been new to Medicare 12/1/19. But if they're new to Medicare as of 1/1/2020 and later, they will not be allowed to cover Medicare Part B. Okay, so Plan F is a plan that everybody used to rave about for decades, because Plan F covered everything. Plan F can now be sold now to someone who just became Medicare eligible since January 1st of 2020 because it covers the Part B. That's okay. There's other good plans. So Plan C and Plan F both cover the Part B deductible. They're not available to new Medicare beneficiaries. But, however, I had a guy call me this morning. He's 73. He's covered by his wife's plan. He wants to come off it and get a Medicare and, a supplement. He can certainly get Plan F, right? Because he was eligible for Medicare before January 1st. So, basic benefits. There's 4 of them. The Part A co-payments for days 61 through 90 and 91 through 150. That's a basic benefit. Plus, if a person uses all those benefits, then the Medicare supplement gives them an extra 365 days of hospitalization. And remember, these are with any insurance company, not just one, any. The Medicare Part B co-insurance is a basic benefit. That full 20% is covered by most Medicare supplements. A few of them, and I'll point them out, cover it just slightly different. Same way with the blood deductible, that's considered a basic benefit. And the Part A, 5% hospice inpatient respiratory co-insurance, also considered a basic benefit. Plans K, L, and N pay for these benefits a little bit differently, and I'll show you that. Now, all of you have this chart in your folder. You don't have to pull it out or anything, and people at home should have that chart that was emailed to them. So on the left-hand side, in that blue column, which to me looks a little blurry, maybe it's just me, the Medicare supplement benefits, those are all the things that I want to have covered by my supplement, right? So when in the gray part, Plan A shows me how they cover Plan B, C, D, F, G, so on. So the basic benefits are the first 4. Co-payments, Part B co-insurance, blood deductible, hospice care co-insurance. That's all Plan A covers. So if that's all I want covered, I can buy supplement Plan A. Make sense? But I want more covered, right? I'd at least want that deductible of $1,556 covered, so I can look to supplement Plan B, and supplement Plan B covers my basic benefits and that Part A deductible of $1,556. Plan C, most of you in the room can't buy because you were not eligible for Medicare prior to January 1st of 2020, but that covers everything except excess charge. The reason you can't get it is because it covers the Part B. Plan D covers the first 4 basic benefits, covers my skilled nursing facility charges, and covers my Part A deductible, but it does not cover the Part B deductible or my excess charges. And remember, those excess charges, at least to me, would be very important, because I'm going to be able to use any document except Medicare anywhere in the country. Plan F, that is considered the full plan. That is only available to people that are eligible for January 1st of 2020, and as you can see, it covered everything, right? So it looks like it's so nice when something covers everything. But look at Plan G. Plan G in 2010 was improved on, and it covers everything just like F, except the Part B deductible. So since 2010, I've always been saying, if it makes sense financially between F and G, just go to Plan G. Right? that deductible, which is $233 this year. I mean, that's a pretty low deductible for most of us if we're under 65, what our deductibles are, right? So Plan F is really nice, but Plan G is still great. And you just have that parking, you got full cover, and again, you've got your basic benefits, you've got your skilled nursing, your party deductible, those all important as excess charges, and some of these plans even cover foreign travel emergency coverage, but it's really not a lot. Okay. In 1992, when these Medicare supplement plans were first available, it was a pretty big deal, the foreign travel emergency. But what it is if I'm outside of the country, and during my first 60 days of travel, if I have an emergency, I would have a deductible of $250, which is okay, but then my supplement would pay 80% of my approved approved emergency charges up to a lifetime maximum of $50,000. 1992, that was okay. It's not so okay. It's nice to have, but if I'm going to go outside the country, I'm going to buy a plan coming while I'm outside the country, right? I don't want to have to pay for something and come back and get my Medicare supplement to reimburse me, 80%. I just don't want to do that. So, and most people I know don't want to do that either. But it is an option. Plan K, you can see that's a little unusual. If Plan K and L pay the hospital co-payments in full, but all the other services that they cover, they only pay a percentage. Plan K pays it at 50%, Plan L, if you could just hold your thought for a minute, Plan L pays it at 75%. Plan M is an interesting plan, covers many of the benefits in full, but the party deductible, they just pay 50%. And they don't pay the Part B, the excess charges either. Now Plan N, because a lot of people, when they look at these plans, they like to look at G and N. Because let's face it, most people turning 65 now, they're looking at G and N, they're not looking at F, right? They can't. So N is interesting, it's less expensive than G, but with N you have a co-payment when you go to the physician's office. It can never be more than $20 though. It could be $2, $10, depending on how much the office visit costs, but your co-payment could be $20. So a person who buys Plan N would be, number one, a person who doesn't go to the doctor very much, right? Okay, so they don't want to incur that co-payment all the time. If you go to the doctor once every 6 months, fine. If you go to the doctor 2 or 3 times a week, you don't want that co-payment. So Plan N also does not cover the excess charges. So if I go with Plan N, I better use doctors that accept Medicare assignment, otherwise I'm going to be responsible for those excess fees. So 2 of my clients bought Plan N. They both eventually switched over to Plan G. Reason, the first one, his doctor accepted Medicare assignment and then changed his mind and said Medicare only. So we had to get him off Plan N, the Plan N would cover excess charges, and we will do Plan G. My other client started using the doctor a lot more frequently. And those co-payments on Plan N, it was just getting to be too much. And some of her doctors started taking Medicare only and not assignment. So we moved her to Plan G. Because even though Plan G cost a little bit more, in the long run, it was beneficial for her because she didn't give all the co-payments. So just some thoughts. And then before we take any questions, I just want to mention that both Plan F and Plan G have high deductible options. So if you like the thought of Plan G, that covers excess benefits and so forth, but you think, well, I'm okay with the high deductible of $2,490, that is available on both Plan F and Plan G.
I'm sorry, can you say that again?
Oh, it's right.
It's at the bottom of the form.
Yeah, it's right at the top of the page, I'm sorry. Both Plan F and G have high deductible options, where if you had a medical service, Medicare is primary, but when you go to your Medicare supplement to pay, it would not pay for it until your deductible of $2,490 is met. And on Plan G, it would be the $2,490 deductible plus the Part B deductible of $233. And then the out-of-pocket limits for Plan C and L, remember those are those 2 different ones where one is paying 50%, one is paying 75%. Plan C and L do have out-of-pocket limits. Plan N, like I said, pays 100% of the Part B co-insurance, except for a co-payment of up to $20 for office visits, and you do have a $50 co-payment for emergency room visits. foreign travel emergency, I already explained that one. So, I want to mention something to you. So Medicare supplement plans, once you enroll in it, most people stay in it because they're satisfied with the plan. And as long as it, they are going to get more expensive as you get older, but as long as it's still affordable and it's still a good buy for you, a lot of people just stay with it. If you want to change your Medicare supplement, you can look to another company anytime throughout the year, ask them their questions, and what I'll do with people, I'll say, well, let's just do a little quick run through here and ask all these medical questions before we formally apply. Because some of the applications will say, if you say yes to this, it's going to be fine, right? So we do that first. And that can happen anytime throughout the year. The reason I bring this up is because the Medicare open enrollment period is starting soon. And a lot of people think they can switch their Medicare supplement plan during that time. And you can't. The Medicare open enrollment period has nothing to do with Medicare supplements. It's all about drug plans and Medicare Advantage plans, not Medicare supplements. So, I just wanted to mention that so you don't think, well, when can I switch it? You can switch it anytime, but before you switch anything, whomever you're talking to about that Medicare supplement, see if you can qualify beforehand and never cancel your Medicare supplement until your other one is approved. Okay? Alright, and let's see. Change, okay, go back. I already said it. There's a birthday rule for changing Medicare supplement plans. I was super excited about this when it came out this year, but it really just meant if you want to downgrade your plan, you can do it within so many days of your birthday. Like, well, people aren't really excited about downgrading. They really want to, move to a company, or maybe they want to improve their plan. So before I start taking questions from you, which entity, organization, provides Medicare Part B? Is it an insurance company or is it the government? Oh, good. It's the government. So many people call me up and say, well, I want to buy Part B. Well, that's Medicare, right? And then a 64-year-old person is collecting Social Security benefit. What do they need to do to enroll in Medicare? Do they need to go online in Medicare 3 months before they turn 65? Now remember, they're already collecting Social Security, or two, nothing. They're already receiving benefits, their card is going to come to them automatically. Which one or two? Two. Good. And I think this is the last one. John Smith did not enroll in Medicare Part B when he was 65, and now when he chooses to do so, he won't get a penalty. For which reason did he not enroll in Part B at age 65? He didn't feel like signing up, which there are people like that. He didn't want to pay the standard monthly premium, $170.10. There's a few like that too. I don't blame them, but they have to have. Or number three, he or his spouse is still working for a company, 20 or more employees, and they receive his insurance coverage through that employer. Three. Good job. Okay. All right. So how about some questions for me? Yes. Yeah.
Just three short questions. It covers hospice. Does it cover palliative care as well?
Yeah, some of the hospice care is just considered palliative.
Okay. Ambulance. It covers that, and is there a certain number of? Is there only once a year you can use?
No, ambulance is covered in the Medicare Part B for emergency services, but if a person needs to be transported, like just say I am in Indiana and I have an accident, but I really want to get back to the Hales Hospital. Let's just say I want to do that at my own choice. I would be responsible for that transport because that's not an emergency.
In non-emergency.
Non-emergency, some people use an ambulance for non-emergency reasons,
Okay.
and then the person is expected to pay for it.
Okay. But if there were two cases within your yearly allotment.
There's not limited to 2 cases. Some people, unfortunately, go to emergency rooms.
Okay, great.
Yeah.
I am on Medicare. I have Plan G Plus,
Oh, okay.
and nobody ever brings this up, except I just found out about it, and it has paid for like dental cleaning
Well,
and X-ray.
okay, so you're talking about a certain insurance company.
A what?
And that's a certain insurance company that offers Plus. That's an insurance company that offers Plus. Plan G, these benefits, but your Plan G benefits with that plan without the plus is just like this, okay? That's what your Plan G benefits are, all right? Blue Cross, you pay $22.20 extra a month for the plus feature. The plus feature covers silver sneakers, a limited dental plan, and a limited vision plan. That's what the plus is, okay? But plus is not a federal program, okay?
It's not a federal.
No, that's a Blue Cross and Blue Shield of Illinois option that you bought. You could have bought Plan G, or you could have bought Plan G Plus, you just chose Plan G Plus.
Can I go back to G,
Yeah,
but just not during open enrollment?
you can go back, you can go at any time throughout the year, go back to G with Blue Cross in that block of business that you're referring to. I just noted you can do that.
Okay, thank you.
Did you not want silver sneakers?
I don't see the advantage of it. That they all say, oh, you have these classes.
Okay.
It's usually,
Okay, so-
I get
so
the
since
emails
you-
and they
so
say it's
So
online.
just so you know, you pay $20.20 for your dental cleanings and an x-ray and maybe a filling, but most of the people at our age don't get fillings, we're getting crowns, because it doesn't cover crowns or anything like that. Just so you know.
Right.
Okay, but if that's okay with you, because when I tell my clients, if you're going to get the plus feature on that particular company, for the $22.20, take it because you want to use the silver sneakers. Because you're going to get your free gym membership, which that's okay, and then if you get the free dental, well not free dental, if you
Right.
get dental and the vision, that's just extra topping on the
Bonus.
cake. Right. But silver sneakers, which is really funny, I was at a meeting a few weeks ago, a lot of people like silver, silver sneakers is good. You can belong to as many facilities as you want at the same time.
Painless Rec Center, Crestwood Health Club.
I belong to
Lifetime.
Crestwood.
Yes.
Are you paying?
I paid for a non-resident.
It would all be free. Go in there with
Yeah.
your card.
You
Go to
have
your
the
insurance
plus
company.
feature.
and
Okay.
You get silver sneakers. You can go to any of these places we're talking about. Lifetime Fitness. Okay?
Yes.
Use
And
the
have their
pool.
pool at this time of year when it's
Okay.
getting close.
I bet they don't give me my money back.
Well, they might not give you your money back, but
They'll
you're
stop
not
charging
getting paid
you.
more.
Yeah.
They what?
You're not going to have to keep paying for your membership.
Well, I paid a lump sum because it was cheaper.
Well, anyway, so that's what you pay the $20.20 for, and that's what I tell people. If you're going to use a silver sneaker benefit, then the $22.20 is worth it. But I will tell you just a little thing. Everybody always wants silver sneakers. You know, oh, don't you have silver sneakers? All these things. And they did a study, and only 10% of all these people that are on silver sneakers actually go.
Oh, I go.
Yeah, well, I'm not saying that you did. I'm just
Yeah.
saying, I just thought that was a fun fact. I mean,
They
I thought that was
did
really
all
cool.
kinds of classes
I want
online.
to talk to you.
Did you have a question?
Can you add the plus to your G plan at any time?
Well, the only company that offers this plus plan is Blue Cross.
Right.
Okay.
If
It
you're
depends on which G plan you have. You know.
I have two questions. So if your birthday is May 28th, does that mean you have to wait until February 28th, or could you actually sign up as early as February 1st?
February 1st.
So you
So it's 3 months before your 65th birthday month.
okay.
So if I'm turning 65 in October, doesn't make any difference when it is, I can start the process July 1st.
And then the other question I have, and I know sometimes you probably would. So for the average person, if you were to say A, B, D, and G,
Yeah.
would that be pretty much for the average person, that would be what we would want to do?
Well, I don't know what you mean by average,
Yeah.
but for like a person wants to be able to go to any Medicare approved provider in the country, and they don't have to worry about like pre-authorization and referrals and stuff, then I would say for that person, original Medicare and supplement plan G and Part D plan, that would be their perfect
A,
package.
B, D, and G.
Say again.
I just said that if you're a person that wants to be able to use any Medicare approved provider in the country, and so you want to have original Medicare, and then you want to supplement, so you don't have to pay the deductibles and co-pays and co-insurance, then you want supplement plan G, and then of course you need prescription drug coverage, which is known as Medicare Part D.
What kind of premiums are there on the Part D?
Okay, Well, the Part D premiums range from $6.90 a month this year to like $85. So that's why that software program that I mentioned using on Medicare.gov website is so beneficial for you. Because instead of just saying, well, I'll just go with the most expensive one or the cheapest one, you plug in your prescriptions and you can see exactly what you will pay at whatever pharmacy that you plug in there, and it'll give you the most cost-effective plan to the least cost-effective plan in order. Okay? So typically though, if you have very expensive drugs, some people have then they're gonna pay a little bit more for their prescriptions, they're gonna pay the more expensive things. Okay, any other questions? All right then, well, thank you all for coming, so we did have more than 3 or 4 people. Just came in a little
Thank you.
Thank you.